Okay, thank you very much. Thank you, gentlemen, for joining us in this year's Great Wall International Congress of Cardiology. It's a pleasure for me to give a short presentation on an ongoing trial on home blood pressure intervention in the community. So we are doing a trial to address a question about the usefulness of home blood pressure monitoring in the intensive blood pressure lowering. So the trial has been started about a year ago. So we want to investigate whether a lower target. So actually here 127 over 70, 125 over 75 versus 135 over 85, whether the lower target would be associated with better clinical outcomes. So of course, these days almost every hypertensive patients do home blood pressure monitoring at home. So you see the inclusion criteria. We do the study in elderly hypertensive patients because these days in China, if you go to a community health center, they actually mainly work with those senior patients with hypertension, because the younger ones, they don't go to the community health centers, or even they don't treat hypertension. And we actually include those treated hypertensive patients with uncontrolled clinical blood pressure. And if they also had uncontrolled home blood pressure over 135 over 85, so we can then randomize them into two different levels of blood pressure control. So you see 125 over 75 as the more intensive group, and versus 135 over 85. So you have seen a lot of publications about clinical blood pressure management with the lower versus higher target, but here is home blood pressure measurement. So you see we plan the follow-up for the first month monthly, then later on every 3 months. What we want is to achieve this more intensive or less intensive goal within these 3 months follow-up immediately after randomization, but of course it's not always possible to achieve the target, because when the patients know their blood pressure at home, and some of them may be willing to control less, and some probably may be willing to control more. So the planned difference was 10 millimeters of mercury, but eventually can be smaller than 10 millimeters of mercury. So we calculated the sample size actually according to a 5 to 7 millimeters of mercury difference in home systolic blood pressure. So in this study, we used a technological platform to collect blood pressure measured at home, and we also use this platform to do the drug adjustment for the 2 different levels of blood pressure control. So you see the trial has been started about a year and a half ago, and we are now still recruiting patients. Hopefully we can complete the recruitment before the end of 2026, then continue to follow them up until 2030. So it's a long-term study. Now we have 162 community health centers participated in the trial, and more than 5,000 patients had been sequenced, and 2,200 were randomized to these 2 different levels of blood pressure control. So here you see the results of these randomized patients at baseline. So you see our elderly people, the average was around 70 years. And Professor Crea just raised the issue of female representation in a trial. Here you see it's more or less half of men and women were randomized into this trial. And the patients had, you see here, clinic blood pressure 140 and over 79. So many of them actually had blood pressure very close to the level, to the higher level of target. And if you look at their home blood pressure, here actually a little bit higher than their clinic blood pressures. Hopefully we can complete the trial within the next 5 to 7 years, and to address this very important question, because these days we all do home blood pressure monitoring, but without outcome trial evidence to support either the higher target of 135/85 or the lower target of 125/75. Thank you. Thank you very much.